You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. You can get a fixed set of teeth, a permanent set of teeth in just a few appointments. With us, we have a board-certified oral surgeon and expert on the topic, Dr. Gramins. Dr. Gramins, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, for people that don't know about you, tell me about your practice. Who's a typical patient? And as an oral surgeon, what are the procedures that you do?
So a typical patient for an oral surgeon is anybody who basically has their teeth or can have a problem with their teeth.
Okay.
This could be a 2-year-old all the way up to somebody who's 104 years old.
104 years old. Now, why does a 104-year-old go to you?
The unfortunate lady had to have a wisdom tooth extracted. So that's one of the many procedures that we do. In our training, we're trained to do facial cosmetic surgery, facial trauma surgery. We do orthodontic surgery, which is jaw alignment surgery, cleft lip and palate surgery. We can do biopsies, pathology, all the way down to doing dental implants and removal of teeth.
So dental implants has become very mainstream. Right? It's very popular, you say. It's
become a very large procedure for everybody in our community. It took off in about the middle 90s, and now it's just exploded.
So no more dentures. I mean, is that true? I mean, the way we know dentures today, you think, what, 20 years, 10 years?
Absolutely. I mean, we see it on a daily basis in our office. We could take somebody who has no teeth and replace every tooth in their mouth with an implant, which I've done, all the way down to putting in just 2 implants to hold in a denture and make it much more stable for them to chew with.
Okay, a lot of guys doing dental implants, and let's talk a little bit about your background and your training. I guess the oral surgeon, you probably have a bias. You feel that you're the one that belongs doing dental implants. The surgical procedures.
The oral surgeons are the guys who started doing dental implants back in the 80s. Okay. We developed a technique in conjunction with a orthopedic surgeon in Sweden. The oral surgeon's training is such that we go to 4 years of dental school, and then we do 4 to 7 years of post-dental school residency in the hospital. In that training, we see everything from, like I said, facial trauma surgery, gunshot wounds. We do cosmetic reconstructions of people's faces. Then we transition into the dental part of our training, which is removal of teeth, placement of dental implants. It's honestly one of the more straightforward and easy procedures that I do on a daily basis.
Does it cost more to go to a specialist if you're like a denture wearer watching this? Does it cost more to go to a oral surgeon?
Our prices are in line with anybody in the community who's placing implants.
Do they have to get a referral to see you, or can they call you directly?
They could just call directly, make an appointment, come in for a consultation.
So let's begin with, why is it what used to take like 9 months for dental implants now can happen in a short period of time?
Well,
what's changed?
With every technology, as things get researched and get improved upon, the technique improves. So what the implant companies have been able to do is put a special coating on the implant, which makes it heal much faster into the jaw. We've also come up with different positioning and placement techniques and guidance techniques that minimize the trauma to the jaw and the tissues that hold the implant in place, and it allows it to heal much faster. We also have instruments that we can use now that they didn't have 5, 10 years ago, where we can actually test the implant and make sure it's healed and ready to go before it gets restored.
What about pain? It seems very painful.
It's really not that painful. I had 2 patients in my office today who said they never used any of the pain medicine that I gave them. It's not a very painful procedure. The bone doesn't have nerves in it. And by minimizing the trauma to the tissues around the implant, we can put an implant in, and maybe you'll have to take a Motrin or a Tylenol afterwards.
Okay, now you have in your office, I guess, a CT scanner.
Correct.
So how has that changed the way you do surgery?
So what the CT scanner allows us to do is visualize the entire facial skeleton. We can position the implants exactly where they need to go in the bone and the face. A lot of times we don't have to do additional grafting or manipulation of the tissue, so we can just put it right in where it needs to go. Very small procedure and minimal pain afterwards.
How many people do you think, how big of a problem, I don't see denture wearers all over the place, okay? How common is it that people are wearing dentures? I mean, in San Diego, would you say tens of thousands of people?
At least.
Upper, lower denture?
A lot of people wear dentures. A lot of people, you don't know that they're wearing dentures. A lot of people, it really affects how they live their daily life by not being able to smile, not being able to eat. You may notice a denture wearer in the restaurant ordering the potatoes and not the steak. These are people we can totally help. I mean, it's an easy procedure to fix. We can get in, put in a couple implants, as many as 10 implants, and get them a full set of teeth where they can chew, eat, and have a great life.
Now, we've talked on the telephone. You say, so a full arch of teeth, 2 implants to give them something to snap in, snap out.
Yeah, what we do is we work in conjunction with a dentist, and the dentist can make them a set of dentures, which are plastic teeth, and those can lock into 2 implants that we put in their lower jaw.
Could they eat with those?
They can absolutely eat with those. What it does is it locks the denture into their jaw, so when they're moving their teeth, they're chewing, the denture is not moving around. It works fantastic for lower teeth. And the upper teeth, we usually put in about 4 implants minimum to hold that in place because the bone's a little bit different. But what that does is it holds it in place. They don't have to use any of that paste or gel or anything like that. And the teeth are much more stable than they were without the implants.
If it's so good, and if, you know, thousands, tens of thousands of, you know, people here in San Diego have dentures, why aren't they all doing it? Because logically it makes sense. Okay, so it works, but
logically, it definitely makes sense. Every patient that I've ever put these in on is so happy after they're done getting the teeth restored. I think people are afraid of pain, which is really not that bad after the surgery or non-existent.
So during the surgery, they don't feel anything, obviously.
Not at all. The beauty of going to an oral surgeon is we're fully capable of putting you all the way to sleep for your procedures.
So you do what, IV sedation?
IV sedation, where you're completely asleep. You won't feel it. You won't remember being there. We do it every day. That's part of the core of our training.
So they don't remember the procedure being done?
You would not even remember the procedure. You won't even remember waking up in the office. Most people call, they're like, I had my implant surgery done. Yes, you did. They're already in there. We have to show them an x-ray to prove it. But the beauty of going to an oral surgeon is you can have that option and you can go all the way to sleep, and people love that. So the fear of having a procedure done in your mouth.
So that's why they're not doing it. They're just afraid to do it.
That's one of the things, yeah. A lot of people, the reason they don't have teeth is they were scared to go to the dentist, and they end up having such bad teeth they all had to be removed, and they end up wearing dentures. So that phobia can be abated by...
So the last thing they want to do, I guess, is to go back to... Especially an oral surgeon, right?
Right.
Everybody's afraid of oral surgeons.
We're a little bit intimidating. Some of the stuff we do isn't so...
But you're saying it doesn't hurt today. I mean, pain is not something they complain about.
It really is not.
Okay, now, I mean, you've been, you know, an oral surgeon. You do a lot of complex cases. But as far as the happiest group of patients, would you say it's the denture wearer that now you can give them something?
I would say absolutely, because on the front end of that experience, I usually get the referral to remove all the teeth on the person, and then I have to put in a temporary denture on some people if they decide not to go right into having implants done. These are the most miserable group of people that I have to deal with, and I feel so bad for them. It's basically like doing an amputation, which is a horrible thing to compare it to, but they're traumatized after that type of a surgery. When they can come back in and I can put something in there that restores their happiness, their health, their smile, their ability to hold their teeth in their mouth, they're the happiest group of people.
So they're never without teeth. So
Correct.
Somebody watching this, denture wearer goes in. Well, I mean, what's that process like?
The beauty of coming to our office is we work with a bunch of different types of dentists and prosthodontists, so there's a bunch of different treatment plans that we can do. We don't give you a cookie cutter treatment plan where you come in and get one treatment and that's your only option. Some people come in, due to finances, they don't want to have teeth. They'll go without teeth, not recommended.
Just a denture?
Just a denture.
Okay.
Some people come in, we'll put in 2 implants for the lower denture. That makes a lot of people very happy. Some people come in, we'll put in 4 implants in the bottom, 4 on the top. That makes them happy. Some people want all their teeth back. I had a lady who knocked out her teeth surfing in Australia. She knocked out all of her teeth in her 40s.
Wow.
She came in her 70s. I was able to graft the area. This is a little bit more complex treatment, but this is something I do. And we put in 14 implants to replace every single tooth that she lost, because that's what she wanted.
And those teeth can last?
They can last the rest of your life.
So it's just like regular teeth? Would you say they're even stronger, maybe?
They're made out of titanium and zirconia, which is a very strong, it basically is what fake diamonds are made out of. It's zirconia. Okay. So it's incredibly strong. That being said, if you don't take care of them and follow up with your dentist and get routine cleanings, they can have problems, but for the most part, they're in there for the rest of your life.
What if somebody's watching this and they've been a denture wearer, let's say they're 75 years old. In San Diego, that is young.
Right.
Okay? But they've been a denture since they were 70. Are they?
Absolutely still a candidate.
Okay, what if they've been told they don't have enough bone for dental implants?
One of the things, the other things that
isn't that true? That could be a problem.
That can be a problem, and especially in certain areas like the upper jaw, the back part of the upper jaw. But we can add bone now to those areas to give us enough bone to put in implants.
From their hip?
We can do the hip. There's newer things that have come out. There's a bone protein that I use, so I don't have to do the hip surgery. So we can do that in the office. You don't have to go to the hospital. It's minimally discomfortable.
So just about everybody's a candidate these days?
Everybody's
without,
a candidate.
I mean, major surgery?
Correct.
So, I mean, what's the oldest patient that you've had getting dental implants?
The one beauty of having an office in La Jolla is most of our patients are between 70 and 95. So I've placed implants in 95-year-olds.
Really? So why would a 95-year-old want to do this?
Some people just don't want to be without teeth, ever.
Okay.
They want to smile, they want to be able to eat, they want to be able to go out with their friends and enjoy their evening. They just want to be happy. They want to have all of their teeth.
So nobody really, I mean, in your opinion, knowing what you know, nobody should be wearing a standard traditional denture with adhesive holding it on.
Absolutely not. It's probably the worst thing that I've seen in medicine and dentistry, to replace something that is missing.
Now, as a recap, so the denture wearer, go over the options then for them?
The denture wearer can come in and get as few as 2 implants to hold in a lower denture, up until you could have every single tooth replaced in your mouth with a dental implant. It all depends on what you want to do. In between, there's bridge work that you can have that's permanently affixed in your mouth, so you don't have to take anything in or out. There's all-on-4, which is a hybrid prosthesis, which is screwed in and out. And there's a denture, a traditional denture with certain attachments on it that clips into the implants in your mouth. Yeah.
Okay, well listen, you know, we have your partner, Dr. Lin, coming on. What could you tell us about him? I know you guys have known each other for many years.
I've known Dr. Lin since 1994. He's a very good friend of mine. We went into partnership after I got done with my Navy obligation and my residency commitments, and he actually trained me how to be an oral surgeon. So I can't say anything bad
So you
about
both do the same things, though?
We do the exact same things.
So if somebody goes in, for dental implants, they may see you, they may see him.
We have an open appointment book. Sometimes some visits work best at certain times to see him. Some people come to see me.
Who do they like more, you or him?
They like me.
They like you more. Okay, good. Well, I want to thank you for coming on the show.
Appreciate it. Thanks,
Great
Randy.
stuff. You've been watching The Wellness Hour. We will be right back. I'm Randy Alvarez. Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here. You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a permanent set of teeth in just a few appointments. With us, we have board-certified oral surgeon, Dr. Lin. Dr. Lin, welcome to the program.
It's a pleasure to be here.
Now, before we get into today's topic, tell me a little bit about your practice. We had your partner on the show.
Yes, Dr. Robert Gramins.
Yes, great guy. And you two have worked together for many years.
Yes, we've known each other since the mid-90s. We met each other in school.
Okay, good. So for people that don't know you, who is your typical patient, and what are the different procedures you do as an oral surgeon?
Well, I mean, every day is different. We treat patients of all ages, from toddlers to the elderly people, and anywhere in between. I mean, it can be from something as simple as dental extractions to treating fractures from trauma, or replacing teeth with dental implants.
So dental implants have become more popular.
Dental implants have really become sort of the state-of-the-art way to replace missing teeth these days.
So when we say at the top of the show, no more dentures, get a permanent set of teeth in just a few appointments, do you think that's the future of dentistry? I mean, dentures as we know them will be gone?
Absolutely. Dentures as we know them have changed considerably with the onset of dental implants. Dental implants have really allowed denture wearers to enjoy chewing and smiling with confidence, almost like they used to when they had their natural teeth.
Okay, let's talk a little bit about the options for denture wearers, because at the top of the show we said no more dentures. So what are, from the very basic to I guess the best that you have to offer?
Well, I mean, as far as implants are concerned, I mean, you can go from things that are very basic, as far as, you can place a couple of implants to support a denture that kind of clicks on and clicks off.
Is that stable? I mean, how well can you eat with those?
They're extremely stable. I mean, they have these days different devices that you can put on the denture that almost engage the implant, and they're so stable that sometimes it's difficult to take these dentures off.
Oh, really? Okay.
Yes.
And what are the age ranges of the denture wearers?
Well, I've seen patients as young as mid-30s who prematurely lost their teeth for whatever reason, to elderly patients into the late 80s.
80-year-olds can get dental implants?
Absolutely. You know, these days it's all about quality of life. You know, if you're healthy enough and you have a sound mind and you want to enjoy things like food and be able to speak and talk to people confidently, then implants have really been a great way to provide that.
Okay, so 2 implants. What's the next level up for the denture wearer?
Well, then you can get a little bit more involved. I mean, you can look at what we call the hybrid dentures, and those are the retained dentures that you place onto multiple implants. So that can range anywhere from 4 to 6 to 8 implants. And those type of dentures are a little bit more, they're a little bit more fixed. They are screwed onto the implants, and they come off a couple times a year for the dentist to go in there and kind of clean around the implants. But that's something that patients enjoy quite a bit because they don't have to take them in and out on a daily basis, and they can wear them with even a little more confidence.
So like 6 implants, 4 implants, you could get a full arch of teeth?
Absolutely. You can replace your dentition full arch with just 4 to 6 implants. It's as simple as that.
What about downtime? I mean, so somebody watching this, let's use a perfect example, perfect world. They go in, they're a denture wearer. What could be the turnaround time if everything goes well?
Well, I mean, if everything goes according to plan, and more often than not, it does go according to plan. Denture implant patients can be back in their game within a few days. It's a relatively, it's a minimally invasive procedure.
So why is it what used to take you guys, and I asked your partner the same thing, what's your take on this? Why is it what used to take 6 months or so could now happen in just a few visits? What's changed?
Well, I think there's a few things that have changed. One is imaging. I mean, we have a 3D CT scanner available to us these days, and we have one in our office, and it really allows for precise imaging and diagnosis of the bone in the area, so we know exactly where to go to place these implants, so it's less traumatic. And we don't have to make as big incisions because we are confident of where the bone is at. The implants themselves have changed quite a bit. There's you know, through research, they've applied chemicals to the surfaces of the implants. They've changed the surfaces of the implants.
So the bone, what, grabs onto the implant?
Exactly. The bone adheres and fuses to the implant surface a lot quicker these days and a lot more predictably.
Now why, but you know, your partner and I, and we were talking to Dr. Gramins, that he says it's not painful, or pain is not something the patients complain about. But it seems painful.
Yeah, you know, I think that goes back from just naming this procedure implant surgery. And when you say implant surgery, it sounds sometimes imposing. But what I tell all patients is that in reality, most patients will tell you that recovery from implant surgery is actually a lot easier than, say, something like a dental extraction. In reality, it's less traumatic. It's a minimally invasive procedure with minimal incisions and minimal downtime.
Now, does it cost more to go to an oral surgeon?
Absolutely not. I mean, we place the same exact implants that dentists place or other dental specialties place. Our training is the only thing that's different.
Okay. Now, I'm trying not to side with you on the show, but you know, when people visit my website, wellnesshour.com, they'll say, who can you refer me to? And we're not a referral site, but I'll say, look for a specialist. Do you have a bias? Do you feel, maybe secretly, or you can tell me here, that oral surgeons are the people that belong doing dental implants? Do you feel that way?
Absolutely. I mean, when you look at implant surgery, you know, you can train anybody to do implant surgery, but the key to doing implant surgery well and predictably and taking good care of the patient is your ability to not only diagnose correctly and render treatment correctly, but to implement treatment not only before surgery, intra-surgery, but also post-surgery too. You want to be able to take comprehensive care of this patient. And oral surgeons, you know, because of our training, we're able to provide comprehensive care. It's really what we bring to the table that's different from other specialties. So
how many denture wearers do you think are in San Diego?
Oh,
upper or lower denture? Thousands?
There's thousands of denture wearers in San Diego. I mean, San Diego is a big retirement community, as you well know, so the patient population is huge for denture wearers. And we see them in our offices all day long. And one of the most common complaints we have from denture wearers is their inability to function confidently out in public, to be able to chew foods predictably. And that's why I think dental implants have really provided a huge benefit to these poor patients.
I mean, is your feeling that nobody should be wearing dentures without something secured onto a
Absolutely. The days of wearing denture adhesives is really a thing of the past. You know, to see a commercial on TV that advertises for denture adhesives really is a foregone error.
Does that bug you, by the way, when you see some of these adhesive commercials?
Absolutely.
It does?
It does. It bugs me because I know that there are other ways that that people can enjoy dentures and not have to wear these sticky adhesives and deal with the taste of those adhesives and the unpredictability of those adhesives.
Now, if it's so good, you know, with 2 implants, snap in, snap out, or a fixed set of teeth, why aren't they all doing it? What's your take? If only 2 implants could change their life.
Yes, I think it's a matter of education and public awareness, and I think that's changing. I think that you know, patients' perception of their teeth is extremely important, and they're very conscientious about their smile and their ability to eat in public. And with the advent of dental implants, I think people are realizing that dental implants really provide a venue for people to restore their ability to chew and smile predictably again.
Your partner I had on the show, oral surgeon Dr. Gramins, he said that it's one of those procedures, of all the things that we do, probably the happiest group of patients when you give people their teeth back.
Absolutely. I mean,
do you find that too?
Yeah, I would say.
And what do they say?
One of the most common things that people will say is that, I can't believe I waited this long to actually have dental implants placed. It's made such a world of difference in my ability to chew and smile, and I don't have to use those adhesives anymore that affect my taste and don't work half the time. It's something that we hear on a day-to-day basis. On
the consult, what do they ask every time?
On the consult, they say, basically their biggest question is, will this allow me to chew and eat foods like I used to when I used to have teeth? And the answer to that is absolutely.
How soon before you could find out whether they qualify or whether they're candidates?
It's almost instantaneous. I mean, as soon as we take a look in their mouth and take some diagnostic x-rays, we are able to decide whether or not they are a candidate for dental implants. And the nice thing about this is that most people are candidates for dental implants these days. There's very few people out there that can't have dental implants, which is, you know, the great thing about this.
So you will work, if they do have a dentist, you'll work with their dentist. Is that how you get most of your patients?
I mean,
right?
We see a lot of referrals from dentists and dental specialties, but we see a lot of people who just want to change their lives. And a lot of denture wearers don't have dentists anymore because they don't need them, but they want to improve their denture wearing ability, and they seek us out because they know that we place dental implants.
Could you make them look like a cosmetic case? Because I feel like I could spot dentures across the room. I mean, are they getting better as far as the look?
Yeah, you know, these days cosmetic dentistry has really reached a pinnacle in terms of our ability to create a very natural smile. You know, these days it's very difficult for somebody to look at a smile and determine whether or not those are actual dental implants or denture retained implants or their real teeth.
And you mentioned that in the green room, that it's more than just dental implants, that it's about a smile. And I mean, how important is a smile in your opinion?
A smile is incredibly important. I mean, it can make it can change a person's personality. It can change a person's perception of people around him and what they perceive of them as well too. I mean, a smile is how you greet people. It's how you say goodbye to people. It's how you meet people. It's incredibly important.
You think there's a lot of people around San Diego that aren't smiling because they don't like their denture?
You know, I believe that there's a lot of people out there that could be so much happier if they were comfortable and confident with their smile, for sure.
What about people, though, that maybe they've been told their teeth have to go? So it's either a question of dentures or dental implants, but what if their gums are too bad?
Well, I mean, the reason their gums are bad is because their teeth are bad. You know, once we remove the culprit, which are the teeth, then their gums get healthy. So really, all these people are all excellent candidates eventually for dental implants.
What about people that have been told they don't have enough bone because they've been in dentures for maybe 25, 30 years?
Well, that's a misconception. I mean, the thing that's nice about procedures that we do these days is that we can build that bone back up so these patients can enjoy dental implants.
Do you ever have patients that went elsewhere and were told they don't have enough bone when in fact you were able to give them dental implants?
We must see that 2 or 3 times a week. That's a
really
a constant scenario, and I think a lot of it has to do with just you know, a lot of people aren't aware of the procedures that are out there that are available to bring the bone back to a level where they can have dental implants.
So it's a matter of training then?
Yeah, it's a matter of training. The oral surgeons are trained in procedures that are reconstructive in nature. A lot of our background is reconstruction, and that's why we are not only able to, but we're very comfortable in reconstructing the jawbone so that you can have dental implants.
So even if you've been in dentures for 30, 40, 50 years,
I can tell
usually one way or another you can get them.
I can tell you from personal experience, I had a patient who was a professor, and she was in her mid-40s, extremely young person. Wow. And she had been in dentures since her early 30s. Very attractive lady. And fortunately, she lost her teeth to bad gum disease. And she came into me because at this point, her bones had atrophied to the point where she was not able to retain her dentures anymore. And she asked me if there was anything that I could do, and I said, absolutely. We came up with a treatment plan, and we were not only able to build both her upper and lower ridges back, we were able to place implants across her upper jaw and lower jaw, and we eventually got her into fixed prosthetics. And she now enjoys fixed bridge work over dental implants.
So it's like a full arch of teeth.
Full arch of teeth.
They don't come in and out.
They are permanent. And she now can lecture to her students with confidence, and she chews and eats like she did when she had her natural teeth.
What does she say when it's all done?
She can't believe that it took this long for her to do this.
Okay, good. I want to thank you so much for coming on the show. Final message, though, to the person missing 1 tooth, 4 teeth, all of their teeth. They have a loose-fitting denture, but maybe they're afraid, or they're worried about pain. What do you say to them?
I would tell you that the one thing that dental implants have shown across the board is that it's not a painful procedure at all. In fact, it's a minimally invasive procedure, and most people are pleasantly surprised by the lack of postoperative pain that happens after the procedure is done. And most patients come back to us saying, I can't believe I was so scared to do that, and I wish I'd done it sooner.
All right, well, thank you for coming on the show.
A pleasure, thank you.
Very, very interesting. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. You can put in Dr. Lin, L-I-N. You could find him there, or you could point a friend to it. And for those of you on Twitter, and you would like to make a positive comment about Dr. Lin and no more dentures, you could hashtag at The Wellness Hour. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.